For the past 2 years, specifically speaking, from 2019 December onwards, there has been a panicky situation due to the pandemic, starting with COVID-19 and its variants, and currently Omicron. Now, Omicron has similarity with the normal flu. That is, it mainly affects the upper respiratory system. So, how can I differentiate between whether this is Omicron or whether this is a normal flu? Actually, in Omicron cases, it has been seen that many of them do have severe headache. Similarly, severe body pain also they have. Some people, even though the fever stays only for 1 or 2 days, even after the fever resolves, the headache and body pain persists, and it is there for a couple of days too. Similarly, they do have also a kind of tightness, they complain in the chest, and sore throat, a kind of itchy sensation in the throat. Some also complain of severe tiredness. In some people, it has been reported that they do have kind of nausea, that is vomiting sensation. Similarly, loss of appetite. All these have been reported. In very few cases, bluish discoloration of nail and lips have been reported. This in fact indicates that the oxygen saturation is very low. If this kind of a discoloration is seen in anybody, they have to be taken to the hospital. I have seen many people who do take a defensive stand. They say that my case cannot be Omicron, probably because they don't have many of the symptoms of COVID. There have been a lot of people who, in spite of being asymptomatic, have been tested positive for COVID. So please do not self-diagnose your condition. Now, in case you have any of these kind of symptoms, it is very important that you self-quarantine yourself. When you self-quarantine yourself, you can be sure that you don't spread your infection to your family members as well as your colleagues. So that is very important. Now, the most important thing that we come across in Omicron is that it is very fast spreading. So as a result, it is very important that all the precautionary measures that we used to take for COVID, it has to be followed in this Omicron also. So I will suggest some of the preventive or the precautionary measures that we follow at Sadayush and that we generally recommend to our patients. First thing is we need to prevent ourselves from getting infected. So for that, social distancing, proper masking, and also sanitization, all these are important. In offices and in homes also, we can do herbal fumigation. Ayurvedic test has mentioned a lot of herbal fumigations which are available in market also. There has been study about this herbal fumigations in the past 1.5 years. It has been scientifically proved that it helps in keeping the atmosphere free from all these bacteria and viruses to about 98 to 99%. Next is using gargle powders. Especially when you are getting exposed to when you have a chance of getting exposed to these kind of COVID patients. So there are certain gargle powders that are recommended in Ayurveda that can be used on a regular basis. Similarly, installation of nasal drops is example Anutailam. Now, in spite of all these precautionary measures, still the virus has entered. Then it is the role of the immune system in our body to keep us safe from the virus attacking or influencing us. So for that, actually, Ayurveda has recommended certain immunomodulatory medicines, especially which are a kind of non-inflammatory ones. These can be consumed on a regular basis so that it helps in protecting us, or it helps in reducing the impact of the COVID virus in our body. Apart from this, proper ventilation, especially the proper cross ventilation, is very important, especially in offices wherein there are chances that many people come in or many people are working together. Similarly, consuming food which is very healthy. What I mean is food that is freshly prepared, which is easily digestible, and avoiding the food that are baked or fried items, very heavy to digest. These kind of food can be avoided so that our digestive system is not put into any kind of burden. Apart from this, regular exercising and also keeping a pleasant state of mind with the help of certain meditation or pranayam. All these can help us in having a healthy state of healthy physical and mental state. So these are the general precautionary measures that we take here.